Each module begins with a description of the content to be covered.
This module describes the advantages enjoyed by organizations that choose to focus on applying lean principles to their procedures and processes. Topics include understanding value from the perspective of the patient or client, how lean originated and how it is being applied to healthcare, the magnitude of performance improvement possible, the impacts on costs and budgets, some of the challenges in implementing lean in organizations. This module describes and explains the importance of training yourself to see and eliminate various types of waste: overproduction, inventory, transport, conveyance, waiting, motion, rework, overprocessing, poor use of people's skills, changing priorities. This module compares some of the fundamental attitudes and metrics of lean organizations with those of traditional organizations and identifies some of the obstacles to transformation. This module describes lean as a process and philosophy and highlights some of the barriers to implementing lean. It lists some of the lean tools in the toolset, emphasizes the need to develop a new approach, and provides some ideas on the time necessary to transition an organization from traditional operations to lean operations at a world-class level.
This course is carefully designed to foster learning that changes behavior. To learn rapidly and to retain new concepts, the learner must be engaged. There are myriad ways to promote mental participation, such as asking questions that focus thoughts onto a specific concept.
If you are buying a product or service for yourself, what is the first thing you look for? Click on an appropriate answer. Price, on-time delivery, quality, service. That is difficult to answer without a specific product or service in mind. You look for value. Whether you are buying a $40,000 car or a week's supply of vegetables, the price, availability, quality, and service all have a place in your decision-making. Our patients and clients use the same kind of decision-making as you do. Patients and clients expect the best possible balance of price, availability, quality, and service. They expect top value.
Recognition that the learner already understands some portions of the concept serves as a mental hook into the learning experience and thus expands on existing knowledge, as evidenced by this simple example. Often, learners have strongly held beliefs about what can or cannot be accomplished, or what is or is not true. Mythbuster sequences, such as the following case study, can help to dispel these notions.
In a major hospital emergency department, there was a large variation in how different team members conducted their assessment, testing, care, and treatment. Impacts included unacceptable patient wait times for initial assessment, unnecessary patient stress and dissatisfaction, unnecessary staff stress and frustration, emergency rooms filled with patients waiting to be moved, emergency room nurses having to provide hospital floor nursing care. The team believed that they had a unique set of problems and that there was just too much variation in their work to apply any standard methods or lean concepts to help them. Do you think they are unique? Yes or no? Well, they certainly will have a large variation in the demands put on them, but this hardly makes them unique. Many teams in many environments are faced with high variability, and they are certainly not unique in thinking they are unique and that their problems are unique. But once the team became engaged, they carried out a major Kaizen, change event. Their goal was development of standard practices to reduce patient wait time and to provide optimum care. The result? A 25 to 40% reduction in patient wait time. With benefits of this magnitude, why isn't every organization lean? A part of the problem stems from the belief that situations are unique and intractable. Everyone has to be convinced to get on side. Management has to provide the necessary support. Implementing Lean involves learning new techniques, putting processes into action, and following a new culture or belief system. It takes focus and commitment to create a Lean culture that can be sustained.
This course also uses case studies to introduce new concepts or to provide concrete examples.
To respond to a pandemic warning, one clinic mixed a large batch of flu vaccine in anticipation of client demand. When clients did not show up, much of the limited shelf life batch was discarded. What could cause the total system to not operate at a balanced pace? Click on All that apply, then click Done. A. Speed. The previous process step is much faster. B. Time. Product is delivered too early for the next step. C. Quantity. This step creates more than the next step in the process can handle. Good. The first processing step was working faster than the second one required. Vaccine overproduction resulted in this waste. There are more. Yes, time can be a factor. It is important that the preceding processing step delivers the right amount of vaccine at the right time as determined by the downstream or receiving process. Good. When more vaccine is produced than the next step requires, the result is waste of overproduction. The vaccine is wasted because the previous step was not working in pace with the next step in the end-to-end process.
Of course, we also precisely define new concepts.
When an end-to-end process stops flowing and a person, staff worker, or the work itself, the patient, has to wait, we have the waste of waiting. Do you recall Mary's journey through the surgical stream? On the day of her accident, even though she had suffered serious injury, she was kept waiting for 6 hours before she could see a doctor. At that point, she was evaluated, but not treated.
Note also the use of the recurrent example to stitch together the learning experience. Because background knowledge and learning speed differ from individual to individual, it is important to give control to the learner. The learner can choose to listen to the audio track and read along on a screen, or to devote time to analyzing graphical information. The audio provides another modality, but is not essential for the learning. We generally provide individualized responses to alternate answers.
In lean organizations, where do most of the ideas for improving process come from? Well, managers are able to bring knowledge and experience and should be part of the team. Who else?
When you choose the best response, then the program advances. So the more wrong answers you choose, the more detail you receive. Some learners deliberately choose incorrect answers first, just for the feedback. But if you know the topic very well, are particularly tight for time, or are reviewing a section, you might choose to advance through it quickly.
Right.
Note that the learner must answer questions the first time through the course, and can always backspace and review, but cannot proceed until a question is answered. On subsequent times through the material, the learner can arrow rapidly or linger over any screen. From the main menu, the learner can revisit any module, returning automatically to the last page viewed in that module. This course recognizes that healthcare is a complex system that requires engaged decision-making.